Hello, have you ever asked yourself about the challenges that one usually experiences since the day of conceiving till the day of birth? Now today, we are having our guest, health provider Stephen Mwangi, who is going to give us the solution. I'll be your host, Robert Mwangi, together with my co-host,
Kinywa Sarah. Stay tuned all through as we learn and get more hints on the pregnancy, on how to hold it. Daktari, karibu.
Thank you.
I would like you, somebody there is asking questions on who is Dr. Mwangi, where did you start, how did you become a doctor? I would like you, in just a minute, explain to us who is Dr. Mwangi and how did you start it?
Thank you. I love being just a health provider, and I'm Stephen Mwangi. And I go to school like another person. It's only that on the process, as you go to school, you have passion of what you'd like to do, and I ended up in the medical field. Yes.
Oh, that's nice.
Okay, thank you. Now, Dr. Stephen, which are the health measures to consider before one conceives?
Before conception or before you get pregnant, it's always good to know how your health is. You need to know your reproductive health, how good it is. And naturally, we always say, eat well, have a balanced diet, be healthy, be going to your doctor for checkups, if it's blood pressure, blood sugars, all those things that all those things that make a human health.
Okay, thank you. And please, can you explain to us further? There's this one common factor, rhesus factor. How does it affect? And does blood group affect the once one wants to conceive?
Thank you. A rhesus factor is a characteristic of a blood group, okay? And that one that defines, that's when you hear people say I'm O positive, I'm A negative, I'm AB. Normally we have about 4 groups of blood groups, blood group A, blood group B, there is blood group AB and blood group O. But some have a rhesus negative. Okay, and blood group A is the one that has the least with the rhesus negative. It's a rare type, a very rare type. And in pregnancy, they are very important because during pregnancy, that's when there are some complications that can come in, either during pregnancy or after pregnancy, after the child is born, due to rhesus. We call it ABO incompatibility. Yep.
Okay, thank you.
Daktari, out there somebody might be asking herself, or at times we get to be involved in that stage of pregnancy, and you hear somebody say, mimi sikujua nilikuwa na mimba, nimejipata tu. Na wengi unapata wanakuja kujua baadaye. What do I need to experience, or what does she need to experience to say that I'm pregnant?
Thank you. There are people who, there are some things, there are pregnancies that we call cryptic pregnancy, all right? People who don't experience any signs and symptoms, and especially those people who have been having irregular menses, irregular periods, let me call it that way. Sometimes there are people who can't feel any signs or symptoms of pregnancy, and maybe after 5 months, that's when they realize, or labor comes. That's when they realize they were pregnant. Right? They don't have any signs, and they usually come, they are rare cases, but they come to people who usually have irregular menses like that, or they don't experience menses in any way, right? Those are the ones who usually experience that. But the others, because of maybe failure of family planning methods, there are some who realize they are pregnant after some few weeks.
Is it healthy for me to experience periods while I'm in pregnancy?
It's not healthy. Bleeding, we call it bleeding when you're pregnant. When you're pregnant, if you experience bleeding, that's a danger sign because it might be happening that you're losing that pregnancy, all right? Or maybe the placenta is separating early, which is not good.
So, in case I get to be pregnant, and then I get to experience those bleedings, which the advice you can give to me or that person out there?
Those are danger signs. And in pregnancy, okay, let's define pregnancy this way. Pregnancy has 3 trimesters. There's the first trimester, okay, that's the first 12 weeks. There is the second trimester, and there is the third trimester. There's the third trimester, that's when you're approaching to give birth. Most of those complications, they come during the first trimester, although you can lose pregnancy at any time. And the first trimester, if you experience, any time in pregnancy, if you experience bleeding, the best thing is to check to the nearest hospital, because it's not a very good sign during pregnancy. Check to the nearest hospital. There are things that they're supposed to do. Maybe they can take a scan. An ultrasound is very important at that time, okay, to determine where the blood is coming from.
Thank you. And Dr., which are the kind of the foods that one is supposed to take during that period?
When you are pregnant, it's a special time, all right? But it's a time that you need to be very keen with your nutrition, and a balanced diet is the core thing. But during pregnancy, there are some things that maybe you require more than normal, like folic acid, iron, calcium, okay? There are some things that we call choline. You need those more because of the development of the baby, and your body is also asking, because you are the host, and the baby is asking more than you need.
Thank you.
Wakati mwingine wengi hatujui chakula gani tunafaa tukule. Unapata maybe umekula starch, umekula a lot of proteins at go. Unaweza mwadvise aje ambaye anapitia hiyo pregnancy, chakula gani ambacho anafaa kule?
Nimesema tena, and I'll say it once again, a balanced diet is the most important thing. But during pregnancy, there are people who go through an increased appetite.
Yes.
And when it comes to increase, especially for those people who have a multiple pregnancy, what I mean by is like twins, right? They usually experience a high appetite, an increased appetite. So you find that person anakula sana. But it's always good to it's always good to try and eat a balanced diet, all right? But then take a lot of water. It's good to hydrate. Sometimes taking a lot of water helps not to have those cravings. But sometimes there are some foods that if you overeat, they also give you complications. If you eat a lot of eggs, we don't recommend you take a lot of eggs. You might have a very big baby, or they might compromise your heart rate, your heart too, because of cholesterol.
Okay, thank you. So it means when you take some foods like eggs, they may cause even one to have a rapid increase in the body weight, and even the change in the skin color, such kind of signs.
There are changes that are there when it comes to pregnancy. When pregnancy comes in, the woman's body has to change. It's definite. So body weight is one of them. And even in normal language or in normal life, we usually say too much of something is poisonous. If you overeat, even normally, if you're not pregnant, or a normal person, if you overeat, there is a risk of being obese, overweight, and you open a box for more health complications, like blood pressure and so on. Right. So when you're pregnant, there is definitely you have to add weight, because you are the host. There is the baby, there is the placenta, there is amniotic fluid. So we always advise the mother, just eat healthy, just eat a balanced diet, all right? Don't eat a lot, okay? But keep frequent eating if you are having cravings, all right? Kura kidogo kidogo, mara mingi kidogo kidogo, mara mingi. But it's normal to add weight.
Okay, thank you. Now, doctor, there are some people who are unable to maintain the pregnancy until the day of birth, and they experience miscarriage. Can you briefly explain to us the reason for miscarriage?
I don't think it's anybody's wish to have a miscarriage, but sometimes a miscarriage is an unfortunate thing, and miscarriage is when you lose a pregnancy. Mostly, we call it a miscarriage before 20 weeks. That's when you lose a pregnancy before 20 weeks, we call it a miscarriage. And there are so many factors that can cause a miscarriage. There are infections can cause a miscarriage. Obesity. There are people who have a lot of weight. They can also, because of the pelvic floor, sometimes they cannot be able to sustain. There's something we call cervical incompetence. Kwa njia ya uzazi, okay? Pale kwa mlango inakuwa haina uwezo wa kuhold. Because the moment a woman gets pregnant, hiyo njia huwa inafunga. Right? So that they can be able to maintain that pregnancy. Saa zingine kuna watu wanakuwa na hiyo shida hawezi. Okay? So akishika mimba at a certain gestation inatoka. So those are HIV. There are some who have, because HIV affects the immune system. So the body sometimes cannot be able to keep that pregnancy. Accidents. They are genetical. There are people who have a problem with genetics. Mostly those are the main causes of miscarriage, some of them.
Okay, thank you.
Whereby you've talked about the HIV, do you mean the STIs and STDs can also have an effect to the pregnancy?
Definitely, they usually have effect to, especially to the pregnancy, especially if they're not treated well.
Yes.
There is something called like, some of the STDs that we have, there is syphilis, there is gonorrhea, yes. There is chlamydia, HPV, and HPV sometimes it is suspected to be causing cervical cancer, right? Like syphilis, and there is the HIV. HIV and syphilis, they pass through the placenta barrier. And you get that a child is born with syphilis, and it's a sexually transmitted infection. HIV the same. And they can affect the growth and development of the baby.
Okay, basing with that miscarriage, is it possible for that person to conceive again?
Yes.
And after how long?
After miscarriage, that doesn't mean that is the end of pregnancy. You can still conceive again, but it's always good after miscarriage to see a health provider, see your doctor. They will always advise you on what to do. There are some changes that come with miscarriage because it's as if you have given birth. So there are some changes that come, but you also need time you need some time to give the body sometimes to recover, so that the body recovers. Sometimes you can stay for three months plus, so that the body can recover to be able to carry another pregnancy.
And basing with the STIs and STDs, which the advice you can give to that person who is pregnant and gets involved in getting those diseases?
Thank you. The moment you get pregnant, the moment you become pregnant, it's good to go to the clinics. There is something we call the prenatal clinics. Yes. During the prenatal clinics, the health provider will advise you on how the pregnancy, the stages of pregnancy, what to expect. And after that, there are those tests that are supposed to be carried out. We call it the antenatal profile. That profile includes the sexually transmitted infections, and the moment they test positive, you are taken through the treatment period.
Okay, thank you. Doctor, there are some people, or it is a common thing out there, where people, they usually say that you experience a pregnancy, whereby you find that the pregnancy occurs on the fallopian tube, on wanaita kwa Kiswahili mimba ya mishipa. Can you briefly describe to us what is that? What is the dangers of that pregnancy?
It's called ectopic pregnancy. And in Kiswahili nafikiri inaitwa hivyo. I'm not very good in that one. And anything that is conceived out of the uterus is called an ectopic pregnancy. And it's a very dangerous thing because at times it can be fatal, because if it overgrows, it can rupture the fallopian tubes and you start having internal bleeding. And you can lose the client or the mother at that time. So it's something that, a pregnancy that is conceived out of the uterus.
Okay, thank you. And which is the advice from you to such kind of a person who can experience the ectopic pregnancy?
You know, the funny thing with ectopic pregnancies is that sometimes it doesn't grow, you can't host it for a long time. It usually goes for 4, maximum 16 weeks. That's too much time. Because within 6 weeks, imeanza kutoa dalili. Okay? There is low abdominal pain, there is a lot of pain, especially on one side. Sometimes you do a pregnancy test, it's positive, there is some spotting. So the best thing is the moment you realize that you're pregnant, it's good to take an ultrasound, a scan. That's when it determines whether it's an ectopic pregnancy. If it's an ectopic pregnancy, you're operated in Maternal. No, ikitolewa, that's dead. The moment ectopic pregnancy, maramigi, it's an embryo. An embryo is the other stages ya mtoto kuformiwa, right? So you are operated, and mostly they are inside the fallopian tubes. So in a total, and that's the end of it. So unless you conceive again, maybe with the other, a human being has 2 fallopian tubes. So maybe you use now the other fallopian tube, because that tube, if it's operated, it cannot help you to conceive.
Lakini sasa juu ni kitu inafanyika na sioni, tajua je imeenda kwa the other fallopian tube.
There is always the moment you get a scan, ule mtu mwenye anakupiga scan, we call him the radiologist, atakuelezea ni pande gani ulikuwa na shida, na daktari mwenye atakuoperate atakuelezea ni pande gani ulikuwa na shida, na atakwambia pande hii tumefunga na hapa ndio mimba ilikuwa, hiyo nyingine ndio itatumika, and you still get pregnant, you can still get the number of children that you want.
So daktari ndio mfunga?
Si kuifunga sasa. You know, the moment the baby is conceived on the fallopian tube, you can't help it anymore. Yes.
Thank you.
Okay, thank you, Doctor. Now, based on the signs of pregnancy, is craving among one sign of pregnancy?
Even normal people, they usually have craving, but during pregnancy, yes. There are people who experience craving.
So not all people?
Not all of them. There are people who go a very uninterrupted pregnancy. Come on, just a normal pregnancy. Hata huwezi sema ako sawa tu, but there are people who have those things. They start having cravings, anakuambia nataka kuku peke yake. After another the next week anakula mchanga. Okay? Which is normal. Those are normal things, but you always tell them it's good to take water, take small meals frequently. It helps to reduce those craving things.
What advice can you give that man there and that person who is with that pregnant person when you're going to craving?
Just encourage them. Let them, whoever is living with that person, keep encouraging them. Let them have small meals. Kidogo mara mingi. Take water. It helps out.
Wanapewa hizo wanataka.
Nah, that one I will not. That will be their decision if they can afford. Sometimes they might ask for those things you can't afford.
Okay, thank you. Does it necessarily mean that once someone experiences craving, it's the fetus who is having that urge of having such kind of things?
That's a myth. That's just a myth. There is nothing like that. Hakuna kitu mtoto anaitisha unless mtoto anakuaga na ile kitu yenye iko kwa ndani ya host, okay? So the most if the host nutrition is okay, right? The baby is okay. Hiyo kitu ya kusema mtoto anaitisha hapo that's usually a myth.
And where does craving come from if it is not necessarily from the fetus?
How do I put that? That's natural, okay? Ni kama vile tu unaweza kaa usikie nataka chai.
It's just from the mother?
Yes. Okay. It's a very normal thing.
Acha tuseme mtoto anaitisha tu. Okay, what else does that mother expect as the changes? Like we have those cravings. Ni changes zipi tena ana expect akiwa kwa pregnancy?
During pregnancy, there are a few changes that come in. The breast, sometimes they become tender. There are people who have very bad mood swings. Very bad mood swings, za zingine analia, za zingine anataka kwenda kwao, hajui kwa nini alishika. Those mood swings, very bad mood swings. Frequent urination, you add weight, sometimes you find that your heartbeats are changing, kidogo. Then you become a bit choosy. There are some things that you like, there are some things that you don't like. There are people who experience a lot of heartburn. As the pregnancy grows, there are some experience edema. Unaona unafura miguu, ama unafura mikono. Then sleeping pattern also gets affected. There are people who sleep a lot. Others they become lazy. Others they don't sleep a lot. They get insomnia. We call it insomnia. Hawapati usingizi. But when they go to the clinics, they're always advised what to do.
Okay, thank you. And how does the exercise help someone during that period?
During the process of pregnancy, during the pregnancy time, it's always good to have exercise because it helps your body to fit in. You are the host. There is something in you, so that's added weight. You need to be flexible enough so that when you also go for, you prepare yourself for lactation, right? To breastfeed, okay? Yeah, your body, you just exercise your body to be healthy. Excessive waste for digestion. That's how it helps.
It is a very important activity.
Very important.
Thank
you. Unapata mwingine anaambia bibi yake umeongeza weight sana, twende gym. Is it healthy?
When you are pregnant, you do just like there are those what we call them. There are those small exercises that you are supposed to do when you're pregnant. You don't go to the gym. There are some exercises that the experts who are good in pregnancy exercises. Yes.
So we don't need for gyms?
No. And it's normal to add weight. When you're pregnant, you don't have a choice. You have to add weight. It's normal. You have to add weight. You don't have a choice.
Okay, thank you. During birth, there are different ways of giving birth. There's CS, normal birth. How does one know that during this pregnancy or during the time of giving birth, it is a must that I will have CS or I will just experience normal birth?
No, thank you. There are things that determines a cesarean section. So cesarean section, we expect every mother to give birth normally. That is the best thing. But a cesarean section is a solution to those mothers who cannot be able to give birth normally because of one thing or the other, because of because of one complication or because of another problem. Like there are people who have a small pelvis, okay? That's when you hear nilifanyiwa CS sababu mtoto wangu alikuwa mkubwa, meaning kuna pahali yake pita. All right? So we don't have a choice. We need to save the baby and the mother. All right? And in this country or in this world, we always try very much to have the mortality rate ikuwe chini. Kumaanisha maternal mortality rate, wamama wakienda kupata watoto age dunia wakiwa kwa hiyo process. So cesarean section is a way of helping a mother to give birth due to certain complications. If a mother has a high BP, there are some, like preeclampsia, there are some things that you can't wait. Maybe mtoto amechoka pia, the fetal heart rate inaenda chini. So there's things you can't wait. So that's why sometimes they go for CS. But these days, these young people, they are funny. There are some who are asking, they don't want to give birth normally, they just want to get operated. I don't know why. They are in a better position to answer that one. But these young people, they are very funny. Some anakuambia, staki. Nataka kuoperatiwa.
Kwa hiyo operation, before tuingia kwa hiyo, tutajibu kama young people. Unapata, once there was a doctor who ever attended my colleague, akamwambia, unakaa mdogo mguu yako, inamaanisha ulizipata normal birth. Hiyo kweli ni effect?
I don't want to call it an effect, but somebody's a human being's structure, at times, it can guide you where you are heading to. Wakati unaenda kwa daktari anakuuliza unasikia aje, unaanza compare signs and symptoms. What you do is that you direct that doctor to the diagnosis. So kwa akili yake anajua, anaanza kufikiria, anajua inamwelekeza wapi. It's like giving a certain direction. So for people who are sana ni zamani, sometimes back, there are people that walikuwa nasema ukivaa kiatu chini ya 40, your heart is small. It was an indication that you have a smaller pelvis, okay? But that's just something. It was just, I don't know what to call it, a myth. But at times it was true, but other times it wasn't. You could still get short people and they give birth normally.
And at times we get, wakati mwenye ameenda kupata mtoto, at times anaishiwa na oxygen and other things. Ama anakuwa hana nguvu. What advice can you give to that person mwenye maybe ako kwa hiyo stage?
If there is anything that will make God forgive women is giving birth. It's not a very easy process. It's a very tough process. Now, giving birth, even normally, it entails a lot of things because there is contractions. You need a lot of air. You use a lot of energy, right, to push that baby out. So it needs a lot of things. So, and sometimes there are people, because of one thing or the other, they feel that energy is going away. And when it goes away, when you just become exhausted, sometimes your oxygen levels, they come down, okay, because of that exhaustion, because it's not a very easy process. It's a very tough process that needs a lot of care. And when they become so much exhausted, sometimes that oxygen levels go down, and it can also affect the baby. Yes.
Okay, thank you. Doctor, there's a time that you stated about different types of twins. You said that there's fraternal and identical. How can you explain to us just how do they occur?
Twins, sometimes we call them they are genetical, and the identical twins is when an egg is fertilized and it splits into two. After splitting into two, that means those two babies, they are using one placenta. They are sharing the placenta. Fraternal twins, they are two eggs. They are fertilized differently by a different sperm. So, but identical. A sperm fertilizes one egg and it splits into two. So you get identical twins, and fraternal, two eggs are fertilized differently and you get fraternal twins.
So it is a genetic factor?
Most of the times it's a genetic factor, and it usually has high percentage into women than in men. Yes.
Okay, thank you.
Tumesikia the other day kuna mama alikuwa amebeba watoto watano. Wakasema about
that means that kama huyo mama labda anaweza kuwa she ovulated and maybe she was using fertility drugs. When you're using fertility drugs, there is a likelihood when you're ovulating, you produce a lot of eggs, and when you become intimate, all of them, they get fertilized. When they get fertilized, you conceive 4, 5, even 9.
so it's possible to release more than one egg.
Yes. Sometimes for those people who have a problem with conception and they're using fertility drugs, there's a possibility you conceive, you ovulate, you release more than one. Yes.
Na tunapata wengi nakaa bila mtoto for quite some time. Alafu ukikaa kupata watoto unapata kama huyu amepata watano. So it's a normal thing.
Yeah, it's because of those fertility drugs. Sometimes after using those fertility drugs for some time, you might find that you are using some more than one egg. And if they get fertilized, if your uterus is big enough, you'll still carry them.
No, because these fertility drugs, we get them from the doctors. What can you see, or which advice can you give to that person who is taking them?
You know, before you can't just take fertility drugs from over the counter. It's always good. There must be a reason behind why are you taking fertility drugs. If you go to your health provider or to the doctor will first ask you for how long have you been married, have you been with your husband all through, and we always say that we have a problem of fertility if you stay for 1 year with your partner and you have not conceived. So from there, now we can start the process of checking what are what are those things that are causing you not to conceive or you people don't to have a baby. Okay? So maybe on the process, that's when maybe the doctor will get to a point that he can put you or she can put you on fertility drugs, and at times you can find yourself releasing more than one egg.
Okay, thank you. Now, Dr. Ali, there's a question. Is there anything that one can do to get a baby with specific gender, like male to get a male baby or a female baby?
You know, there is technology as we move on. There is something we call pre-implantation something, and it's only done in IVF. In IVF, that is in vitro fertilization. It's usually done to those people who are not able to conceive naturally. With those, you can be able to choose. But any other time, it's not, I can't say you can choose, but it happens that the man is the one who carries the genes of either a male or female. The woman has the X. Okay? In school, there are some things that you are taught about genetics. So the man has the X and Y. That is the female sperm and the man's sperm. The man's sperm, yes. But the female sperm is heavier, so it moves slowly. The man's sperm moves faster, right? And there is an analogy that if you become intimate some few days before ovulation, the male sperm might die before you ovulate, before the woman ovulates. And if when the woman ovulates, the egg will meet the female sperm, and that they might conceive a girl. Okay, but normally we don't usually rely on that so much.
It is not very sure.
It's not it's not a sure thing. But because there are some men that even naturally, even within our society, unakuta kwa familia ni vijana tu, hakuna msichana. So that one tells you that kuna uwezekano huyu mwanaume akona jinsi ya vijana peke yake.
Thank you.
Apart from infertility, what else can bring up that one kukosa kupata mtoto? Nini ingine ina facilitate kwa hiyo?
There is some things like there are some, what do you call these conditions? Those sexually transmitted diseases, if they stay for long without being treated, you might develop something called PID, pelvic inflammatory disease, and that becomes another problem. Kufanya ukose kushika mimba. Okay, sometimes the tubes can be blocked. There is another problem that we call the PCOS, polycystic ovarian syndrome. The ovaries becomes too big, and sometimes they are not able to. You are not able to ovulate, so it becomes hard for you to conceive.
Now, is it family planning?
Family planning, they usually don't have a problem with conceiving. The only thing that they do, there are some family planning methods that you can use. Hormonals. There are some hormonal family planning methods that you can use. When you want to get pregnant, they take some time. You find that it is drain, but they can't make you infertile.
Na hapo awali tukirefaa kwetu tunaweza sema wengi wanapitia through FGMs. Can they bring up your infertility, ama can it affect pregnancy or conception?
Unless FGM causes a problem, it brings in an infection. FGM, what it does, it brings complications in pregnancy, because it's an outroad thing. But for those who still practice it, you find that even when the mother gets pregnant, when it comes to giving birth, it becomes another complication. You get the mother goes through a lot of problems to get a normal birth, because maybe after FGM there were some scars that formed. Sometimes the birth canal started having problems. It is shrink, ikashikana pande zote mbili. Now the place is very small, unless now you start operating that before, which is another process that can bring a lot of infection at times.
Thank you, our viewer. We can see your questions coming up. We have Karen. Karen is asking us, why do you get periods while having cryptic pregnancies?
Come again?
Anauliza kwa nini tunapata periods wakati tuko kwa cryptic pregnancies.
Cryptic pregnancies. I said earlier, cryptic pregnancies is a pregnancy that most of the people don't realize that they are pregnant. Okay? So you don't think that you're pregnant. So your body is telling you that your life is going normally, the menses is abda course. Right? So because of just hormonal changes, you may get some spotting menses kidogo until that day that you go for a scan or labor comes. Ama usikie mtoto akicheza.
Na mwingine, our viewer Johnson, we can see you, anauliza kwa yule ambaye amepitia FGM, unaweza advise aje hivyo ambavyo umesema inaweza leta shida wakati wa kupata mtoto?
Now, Sasa, there is nothing you can do because you have gone through the process. The best thing is that when you get pregnant, it's always good see a health provider. If you had gone through FGM and it has a problem, It's always good. See your doctor, see your health provider, and they'll guide you what to do. So, because if you conceive and you have gone through FGM, even when you go to the hospital or to the where you want to get those services, they'll guide you the best way to. They will know how the best way to handle it.
Thank you. I think my co-host have exhausted the questions. We go there to the quick fire questions. Now, Doctor, I have here some few questions to you, which are quick fire. I expect you to answer just faster. First one, what is your full name? Your full name.
My full name?
Yes.
Stephen Mwangi.
What is your current occupation? Your current occupation?
I'm a health provider.
Describe yourself in 3 words.
Pardon?
Describe yourself in 3 words.
3 words. Passionate. Hey, that's a tough one.
Okay, pass. Who is your mentor?
My mentor? My dad?
Messi or Ronaldo?
Messi.
What's one common misconception about health?
Pardon?
Misconception about health.
Misconception about health. Family planning causes cancer.
What's the first thing to do to a person experiencing heart attack?
Heart attack?
Yes.
No.
The first thing to do to a person experiencing heart attack?
Pass that on.
Thank you.
Does bathing with cold water bring up pneumonia to one?
No.
Explain.
Does cold water?
Does cold water bring pneumonia to one?
No, it doesn't bring pneumonia. Cold water is something that we need to use, and we use in every day. It's our normal thing. But pneumonia is caused by a bacteria called pneumococcal. So cold water doesn't carry pneumococcal.
Describe a perfect balanced diet supper for a person in Meru.
Describe a perfect
balanced diet
for a person
in Meru County.
In Meru County, you don't eat in the evening. Nutritionally, you're not supposed to eat when you're going to sleep. But if you have to eat, it's good to have carbohydrates or starch, protein, and some greens, then fruits.
Greens include mira. One sentence advice to maintaining a healthy lifestyle.
It's always to do exercises. Exercises are very important in your health. And dehydrating yourself, taking a lot of water.
One sentence advice to the Gen Zs.
Keep going.
Wow. We press on. Which disease do you fear most?
Tetanus.
If you are not in the field of health,
yes,
which field would you be?
Which field I would be? Another career? Another career I don't have. I'm passionate about health, but after work, I like going to the field.
Nilingoja useme kuwa pastor. If I may ask, which is your favorite song?
Pass.
Hata sioni haya bado iko. Thank you. Ask me one question. Na isikue ni nini ninakula sababu niko Meru?
Which is the most important thing that you do after work?
Eating.
And one for me.
Would you marry somebody of your age?
Yes. Thank you. Thank you, Dr. Now, as we conclude, I would like you to just give your final remarks.
Thank you. I would say this to anybody who is planning to get pregnant, anybody who wants to start a family, that pregnancy, it's a process and it needs a lot of care. And a man is also important in pregnancy. They are very important people. They should give the assurance, they should take their wives when they are pregnant to their clinic. They should give them the right support. But the moment you realize that you're pregnant, it's always good to go to the hospital, go to the clinics, go to the health providers, let them guide you on what to do. These days we have come up, there are technologies. There are even areas that you can the said messages asking about pregnancy. Go to the clinics, go through your prenatal care early enough so that in case there are problems, in case there are complications, they are detected early. The first 3 months of pregnancy, it's good to take a scan so that we check for any complications. And it's always good to take, let me say it here that it's always good, the moment you realize you're pregnant, start taking folic acid. Folic acid is it's a very small drug, and yet it's very important because it helps to the growth of the baby. The first 3 months, it's very important. Then go on with your clinics, and you'll be fine.
Thank you. There might be someone there who is watching us, would like to reach you or have a personal question. Would you mind giving out your number or how to reach you?
We are in the private practice at the moment. We have a clinic just opposite Paramount called Family Solutions Medical Center. And my number is 0722. Or I'm not allowed.
You can get out. It's allowed.
0722 936700.
Thank you very much. That was our provider, our health provider, Stephen Mwangi. We are very grateful to you for watching us. As we conclude, I was your host, Robert Mwangi.
I, Kenya Sarah. We are happy for you. Hope you've learned. Hope you've enjoyed. And most so, we expect you to practice what you've learned. And beyond that, stay tuned even next time as we wait to learn more on how to nurse that child that you've given birth to.
Till next time, like, share, and comment. Thank you.
Bye-bye.